Thank you, Mr. Chairman, and thank you for holding this hearing. As you know, I've been working on telehealth for almost 30 years now, and this is the first time since I've been on the committee that we've dived into the subject, so it's great that we're doing this. I'm grateful to you and for the excellent witnesses that we have today. But, you know, more than 2 years ago, I introduced a bipartisan, bicameral legislation called Connect for Health Act. That bill included language allowing HHS to expand telehealth in Medicare during emergencies. And 6 months later, the pandemic started, and that language was signed into law as part of the very first COVID response package. That was over a year ago. And 13 months later, telehealth is one of the few silver linings of our COVID-19 experience. And because Congress acted swiftly, millions of Medicare beneficiaries have been able to visit their doctors remotely without risking exposure to the virus. And millions of providers have been able to stay afloat by providing care virtually. I can't tell you how many people have come to me from my district and from across the country urging Congress to make these services permanent. And that's why, as we round the corner from COVID-19, it's time for Congress to act once again. I have another bill making permanent much of the expansion of telehealth and Medicare that we've seen over the last year. I'm proud to have written that bill with my colleague on this committee, Mr. Schweikert, and I'm pleased at the robust bipartisan support we've received so far. I know there are important questions still to answer, many of which our witnesses have been speaking to. In particular, it's critical for us to focus on 3 points. First, we need to maintain the stability of the Medicare Trust Fund. When done right, telehealth saves money. It should not simply drive up utilization costs. Second, we need to expand telehealth equality. Telehealth can help address so many of the inequities in our healthcare system, many of which are a top focus of our committee. But we need to do this right. We can't let telehealth become another division between the haves and the have-nots. And third, we need to monitor the quality of care. If we're going to spend taxpayer dollars on telehealth, those services need to work. This is first and foremost about patients, and healthcare make more sense in some areas than care than others. And that's what I'd like to ask our witnesses about. And I'll start with Dr. Mehrotra. Dr. Mehrotra, in your testimony, you called for making permanent much of the telehealth flexibilities in place during the pandemic, but you also highlighted with admirable precision the challenge posed by high-value versus low-value healthcare. Can you talk a little more about how Congress can balance those priorities? In other words, how can we make as much of the telehealth flexibilities in place permanent while incentivizing high-value care whenever possible?
Well, thank you, Representative Thompson, for doing all your work in this area. I think it's so critical, and the caucus's work, specifically on the high value versus low value applications. The other area that the Congress could consider, and has already done so, is to consider selectively expanding telemedicine for select conditions. In the FAST Act, you expanded telemedicine for stroke care. In the SUPPORT Act, you did it for substance use disorders. And more recently, you've expanded access for mental illness. And in the same way that the Congress could say, these are certain conditions for which we feel telemedicine is most important. Maybe the one that I would focus on is chronic illness. We all recognize in the United States how poorly conditions such as diabetes, hypertension are controlled. And it could be, just as several states have done, that the Congress could expand telemedicine for those high-value applications.
Thank you very much. And Dr. Mehrotra, we've always kind of focused telehealth on dealing with problems in underserved areas. But is it fair to say that well-served areas can benefit from this too, as a time management tool, better access to healthcare while managing family needs and job needs?
I think that's a really critical point. As we all recognize, getting to your doctor's office, coming to see me in clinic is a pain. It takes a lot of time out of people's valuable time out of people's lives. And so we should always emphasize and recognize that in many cases, if the visit can happen via telemedicine and save Americans time, that's going to be a very valuable benefit of telehealth. That's true for wealthy or poor communities.
Thank you very much. And again, thank you, Mr. Chairman. I yield back.